Okay. All right. My name's Susan Anderson. I'm an instructor at CanScribe, and I'm happy to see so many of you are here today. That's great. There's a segment on the right that is blacked off. Let me just take that down. How is that? Is that better? Okay, perfect. Okay, great. Okay, so today we're going to talk about some punctuation rules and some run-on sentence issues and some other punctuation rules that keep you up at night. Is punctuation giving you nightmares? Well, I hope not, but it seems like this is a subject that a lot of students have problems with. So we don't want it to give you nightmares. Does it give you a headache? I'm sure. Yes. Uh-oh. Krista says she wakes up thinking about commas. When you think of punctuation, do you want to go running away? I feel like that too sometimes. So y'all are not alone. Punctuation is supposed to bring order to our world and not chaos. So it does make a difference in how a sentence is punctuated. A misplaced punctuation mark can change the entire meaning of a phrase or sentence. I apologize. Let's take a look at this. Let's eat grandma. What? Okay, so if you have the comma in the right place, it makes more sense. Let's eat grandma. It says punctuation saves lives. I'm not sure, but anyway. So let's look at another reason why punctuation is so important. Because of a displaced comma last year, a lawsuit was brought about by Oakhurst Dairy. You can Google it. It ended up being a settlement of $5 million because there was one misplaced comma. It changed the list, and it included work being paid for or not being paid for, excluded work for not being paid for. And anyway, they ended up with a $5 million settlement just because of one comma. So it's important to know the rules and to go over them. So let's look at some other examples where misplaced or no punctuation changes the complete meaning. The patient had 2 children, a dog and a cat. Well, the way this is punctuated, it makes it seem like the patient's children are a dog and a cat. So it should be the patient has 2 children, comma, a dog, comma, and a cat. And it changes the meaning completely. It's silly, but again, it matters. It does change the meaning. So here's another one. Let's cook and eat, folks. Okay, instead it should be let's cook and eat, folks. So it's just another example. I saw this one on the internet. I love baking, my kids, and my pets. And it should be I love baking, comma, my kids, comma, and my pets. So even though this is a silly example, you can see that it does change the total meaning of that sentence. Saw this one. I am sorry, I love you. Well, that hurts. It should be, I am sorry, I love you. There's a huge difference. So, it does matter. We keep talking about punctuation, and I know y'all stress out about it, but it does make a difference. But you can do it. You're going to get it. So let's look at some examples in medical transcription. This sentence could be punctuated several ways and could change the meaning, and it could jeopardize patient safety. Amoxicillin 250 milligrams, comma, aspirin 81 milligrams, lisinopril 10 milligrams, recently added hydrochlorothiazide. Doctors talk in fragments, and so it's hard to know sometimes, but it's more than likely going to be amoxicillin 250 milligrams daily, comma, daily aspirin 81 milligrams, lisinopril 10 milligrams, and recently added hydrochlorothiazide. Now, if you can't figure it out, and especially if it's a medication, leave a blank in what you think it should be after the blank. But you can see that it does change wherever you place that comma. It changes it totally. Okay, this is a bad one. Inability to eat, diarrhea. Of course, it should be inability to eat, comma, diarrhea as a list of symptoms. But, you know, I mean, it just, you know it and I know it that should be there. But, you know, anyway, it changes the meaning. The patient was given ibuprofen 800 milligrams. Yesterday was given aspirin PRN. So you have to listen to what the dictator is telling you. Does he pause before yesterday, or does he pause before was? Two different meanings. The patient was given ibuprofen 800 milligrams yesterday, was given aspirin PRN. So this is just another example, and it's just another, you know, you just have to be careful, especially around drugs, the way you punctuate things. It does make a difference, and it can change the meaning of a sentence. So punctuation questions are probably the most frequent questions we get as instructors. But it is important. I would say when you're learning punctuation, and I know you all have these questions, the first and foremost, let's get those account specifics learned, you know, and then your terminology, and then you can learn the punctuation as you go along, as you are now, coming to these webinars, asking questions, and everything. But it's all of it is important. So it would be fantastic if punctuation was simple, that everything was black and white, and all the rules just made, you know, perfect sense. Wouldn't it be great? Wouldn't it make our lives just fantastic? What if the dictators actually added in the correct punctuation? I mean, wow, that would be like a magical kingdom or something. Well, that universe does not exist. And yes, I feel like this sometimes too. And moreover, yes, it would. Moreover, while there's a set of rules for punctuation, there are also often acceptable variations, and that leads to more confusion. And then you can also have more than one VOS rule for punctuation. So it's just a combination of continuing to learn, continuing to apply, you know, the book of style rules, and asking questions. You can learn these rules. You can do it. Sandra says they do and usually wrong. That's right, or at least Keith says it. I have doctors say comma, put one, and Keith says nope. I know we cannot trust those doctors. They're super intelligent people, but they're not always the best at punctuation. So let's get started. And I know some of y'all know all of this, but we're going to start with the basics because we continue to see these comma issues, and I want everybody to understand the basics. So let's go. It may be redundant, it may be boring to some of you guys, but let's just go. So to understand punctuation better, let's start with the very basics. A sentence consists of a subject and a verb. A complete sentence is a phrase with a subject and a verb that can stand on its own, and it's not dependent on another sentence. So what makes a complete sentence? I apologize. It's the subject and the verb. So in this, the patient is a 55-year-old female. Patient is the subject, is the verb. She comes in today for follow-up of her hypertension. She is the subject, comes is the verb. So the subject is the main thing being talked about in the sentence. And the verb is the action word. It describes an action, a state, or occurrence. And then they're helping verbs also. And they help to form a verb phrase. I am going, you are, whatever, I can't think of one. Did have, has been, will have. So the list is exhausted. Summarize, every complete sentence has a subject and a verb and is a complete thought. The subject basically is what the sentence is about, and the verb tells about the subject. Some of the most common errors that we see are the run-on sentences and or the comma slices. This is what we see. So the patient was running a fever of 103. He was given ibuprofen and Tylenol to bring his fever down. So without that punctuation, the two complete sentences, the patient was running a fever and he was given ibuprofen. There's no conjunction joining these sentences. So a lot of times, students will not start a new sentence after the 103.5. So this is what you call a run-on sentence. Now this, a lot of times, and this happens so many times, the people use a comma instead instead of leaving it off. This is a comma splice. And it is when two sentences are together that have no conjunction in between, and you use a comma. That's not correct. You need a period or a semicolon. So the only difference between a comma splice and a run-on sentence is that a comma is used for the comma splice. But they're both wrong. Both of those, the patient is sick, he is in bed. The patient is sick, he is in bed, with a comma between it. Both are incorrect. The correct way for two sentences is either a period, a full stop, or a semicolon. He is in bed. And both of those bottom two are correct. So let's do a quick exercise. And you guys can just answer in the chat box, okay? So I want you to identify the subject and the verb in each sentence. The patient came in today. So what's the subject and what's the verb? Right. That's right. Patient is the subject and the verb is came. Very good. Okay, let's try this one. I referred the patient to gastroenterology. What is the subject and what is the verb? Okay, everybody's getting this. Okay. The patient, by the time he arrived to the ER, had a fever of 103 degrees Fahrenheit. What is the subject and what is the verb? Okay, patient had. That's right, Krista. Patient had. By the time he arrived to the ER is an interrupting element, excuse me. So really the sentence is, the patient had a fever. So patient is the subject and had is the verb. Good job, guys. While being seen in the emergency room, the patient fainted. Okay, what's the subject? What's the verb? That's right, patient fainted. And you don't have to add the, but yeah, just say, I apologize. Okay, good job, everybody. Okay, so that's just a recap of that. All right, let's add on. Complete sentences need a full stop. So the period is the punctuation for a full stop. The period is for termination of a thought. So while in the ER this evening, the patient was running a fever of 103.5. Full stop. Need a period. He was given ibuprofen and Tylenol to bring down his fever, or his fever down. Full stop. Two complete sentences, two complete thoughts, two full stops. No conjunction after. It's just two complete sentences. And this is where we start getting into trouble. When two full sentences without a conjunction or joining words are used without punctuation in between or with an added comma. And that's where you get the run-on and the comma splice. So you can punctuate these two different ways. You can use a semicolon or a period. I think the easiest thing is just use a period. It's nice if the sentences are related to use a semicolon, but it is not necessary. And you can use a period. It's the simplest thing. So for example, here, if you add these two sentences together, you can add them with a semicolon or you can add them with a period. Either way, you cannot use a comma and there has to be some punctuation there. Okay, so we see this very, very often. This is what we see. The patient was running a fever and then with a comma. And we see that so many times that you cannot do that. You have to join that with a period or a semicolon. Only you can prevent comma slices. I know, I feel it. Don't let punctuation do this to you. I found this picture that was appropriate of what I feel like some days after grading punctuation, and I know you guys feel like that sometimes, maybe not that bad, but okay. So another way to look at this is that if there's no conjunction, just use a period. I mean, it's the simplest thing, just to put a period after that. But connecting words change things. So connecting words or conjunctions include and, but, for, or, nor, so, or yet. And there are others also. So you think of run-on sentences as few sentences, two complete thoughts. Again, this is, without the punctuation in between. So let's do another quick exercise. Apologize. Okay, so I want you guys to identify the following as either fragment, complete, comma, splice, or run-on. And let me say this before we start, that when you take your pre-employment test for when you go to, try to get employed, they will ask you, the first part of the test is identify these as fragment, complete, or run-on. And so you need to know the difference of what these are. Okay. Having nausea, vomiting, and diarrhea. Is this a fragment, a run-on, a complete, or a comma splice? Okay, good. Everybody's getting it. Fragment. Very good. Very good. How about this one? The patient was sick. Complete, fragment. Absolutely. Everybody got that. So good job. Complete. I saw the patient on May 30th. He was transferred to the hospital immediately. Fragment, run-on, comma splice, or complete. That's right. It's a comma splice because there's a comma in between there. Now, that would have been corrected either period after 30th or semicolon. Seen by a physician. What is this? Okay. Good job. All right. Everybody, it is a fragment. It doesn't have a subject. And you sometimes it's understood, the subject is understood, but not in this case. Okay. So here's just the answers for those, and everybody got them correct. Good job. Let's go on to just a couple more. His PCP referred the patient to me and also to the gastroenterologist. Is this a complete, fragment, run-on, or comma splice? Okay. This is actually a complete sentence because there's no new subject. So his patient referred the patient to me and to the gastroenterologist. So it's just a combination of like a me and a gastroenterologist. So there's no new sentence after that. Okay, so it's a complete sentence. Because the patient was not taking his medication. What about this one? Yes, fragment. It's dependent on another sentence. So good job. Good job. As instructed by the pediatrician. Okay, you guys are getting this. Maybe it's great. A cough with sinus drainage. Just a couple more. Good job. Well, y'all will do really well on these tests. That's good. Okay, how about this one? The patient had nausea and vomiting. He was also having diarrhea. Right, absolutely, run-on. Okay, you guys, good. Did very good. Okay, so again, just wanted to stress that you can use a period or a semicolon. Okay, let's just take these examples for vital signs. We see this over and over and over. I think the easiest thing to do, really and truly, is just use a period after your vital signs. Here, BP is the subject, is the verb, pulse is the subject, is the verb. The same with respiratory rate and weight. So all of these are sentences. You can't use commas here, or that would create comma splices, and you'd get it wrong every single time. If there's a verb involved, it changes everything, and you have to treat it as a sentence. So it's best just to, I think, personally, the easiest thing is period. What if there is no is? You can still use a period if you want to, or you can use commas if there's no verb. So, the verb changes everything. The verb makes it a sentence when you have that subject. So you just have to consider that. If there's a verb, period, or semicolon, or if there's no verb, you can just use commas. Okay? Let's take another quiz. So these are multiple choice, and you can just choose the correct answers. There may be more than one. Okay, so when I last saw the patient, she was just getting back from vacation. She comes in now for a follow-up on her hypertension. And you can see the different ways that is, excuse me, I'm so sorry, punctuated. So which one? Okay. 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 A lot of people are saying A. Some people are saying A and C. Some people are saying C. The correct answer is A and C. You can use the, let's go back and look at B, because that is a comma splice. When I last saw the patient, she was just getting back from vacation. That's a whole sentence, period, full stop. She comes in now for a follow-up on her hypertension. You can't use a comma there. Okay. So A and C were correct on that one. Good job, guys. I can't talk. Okay, so the patient states that she fell on Tuesday. 2 days later, she developed pain in her right leg. Which of these are correct? Maybe more than one. Okay, I'm seeing some B, A, and B. Okay, and the answer is A and B. And let's look at C and see why C was incorrect. The patient states that she fell on Tuesday, period, full stop, full sentence. 2 days later, she developed pain in her right leg, period, full stop. Okay? All right. I had recommended that the patient be seen in the dermatology clinic. She comes in here instead. Which of these? Okay. I know this may seem redundant, you guys, but I want you to get it. I want everybody to understand it, okay? All right, let's see what's right. B and C. So let's see why A wasn't correct. Okay, that's a comma splice. 2 full sentences with a comma. So good job, everybody. I think everybody got that one. That's good. Have a couple more here. I think that the patient's hypertension has improved on her medication. She is going to continue taking it. How about this one, guys? Okay. Okay, good. I think everybody got that right. Let's see why C, it's a comma splice. So very good. And one more. The patient is on an aspirin a day, a multivitamin a day, and she is on lisinopril for her hypertension. This one's a little bit different. Which is correct? Which ones are? Okay, good. You guys are good. B is the correct answer because of Book of Style 6.2.3. The reason being there's a conjunction being used and it changes everything. Is a comma splice or just not necessary? Well, it actually, with the conjunction, it changes everything. It goes to Book of Style 6.2.3, and you can't start a sentence with and there's no need for a semicolon because you just need a comma in this instance. So we're going to talk about 6.2 in just a minute. Okay, so note the change without the conjunction. Had this one been just the patient is on an aspirin a day, oh, I didn't put the comma there, she is on lisinopril for her hypertension, and you could use a semicolon or I forgot to put the commas in after the drug. But you see the difference without the conjunction. You can use a semicolon or a period. But with the conjunction, let's look again, you have to use the comma before because it adds on to the sentence. It joins the sentence. The conjunction and joins that sentence to the first sentence. Okay, one more. Patient had nausea, vomiting, and diarrhea that all started after a high fever, and she also has a severe headache. Okay, what about this one, guys? Mhm. Mhm. Okay. Correct answer is A. Same thing. It has the conjunction a, and that changes everything. So let's look back. This um, is, again, you don't need a semicolon because there's a conjunction there joining the two sentences. And this, you don't want to deduct. Yes, Sunshine, the C is wrong because the word and was dictated and it was not transcribed, so that is a verbatim issue. All right, so let's talk about a couple more book of style rules. We're going to go over quickly just a couple. Book of Style 6.2.1, it just says to use a comma to separate two or more adjectives, modifying or describing the same noun. So all of these below are describing the nouns in red. Pleasant, elderly, female, well-developed, well-nourished. The list could go on and on. There could be 20 descriptors or adjectives describing a male or a female. Non-tender, non-distended abdomen. You just have to, non-tender is not describing non-distended. It's describing abdomen. So you have to put a comma in the middle to separate those. Pleasant, alert, cooperative. It can go on and on and on. Okay, that's a pretty simple one. 6.2.2 says to use a comma to separate two or more items in a simple series where none of the items contain internal commas. So let's break that down. Here's some examples. The patient had nausea, vomiting, and diarrhea. So there's a comma after nausea and vomiting, before and, included fever, comma, sore throat, comma, cough, comma, body aches. Doesn't have to be just one phrase or one word. It can be more than one. The patient has no fever, chills, or shortness of breath. Items in the list separated by commas with a conjunction joining them. You put that comma in before. You do not use a comma if all of the items are joined by and or. So let's take a look at this. The wound has no redness or drainage. And that can be anytime a conjunction joins a phrase like that without, if it's not a complete sentence, there are no commas used. The patient has nausea and vomiting and diarrhea. The patient has no nausea or vomiting or diarrhea. The list can go on and on and on. I apologize. But as long as there are conjunctions joining the words, then no commas are used. I don't care if there are 50 of them, although you probably wouldn't see that. But the patient's symptoms include fever and cough and sore throat and a little bit of shortness of breath. No commas. Now, you'll see this out in the work world. You'll see it out in other just any kind of report or anything. But if AHDI and AMA recommend the inclusion of that comma before the conjunction for clarity, it just makes things that much. It changes the meaning sometimes if you don't have that comma. Sandra says that is what gets me all the time. So hopefully now I will get the and list thing. Okay, good. I hope so, Sandra. And if you don't, give us a call and we can go over it specifically with you. Okay, we want you guys to understand these rules. All right, so let's take another quick little quiz. So choose the correctly punctuated sentences. Just tell me if this one is correct or incorrect. All right, you guys are doing very, very well. Sandra says, oh, I've gone over and over how it'll sink in. Incorrect. That's right, incorrect, because need a comma after the ENT. Very good, guys, very good. All right, how about this one? I started the patient on vitamin D, calcium, and magnesium. How about this one? Okay, everybody's on getting it. That's great. All right, so that one just shows you that that's what it is. Okay, the patient had a CT scan of the head and neck, an ultrasound of the abdominal region, an X-ray of the left hip, and a chest X-ray. Correct or incorrect? Okay, I'm seeing mostly incorrect, and that is right. You would just use commas. There are no internal commas. We're going to go over those in just a minute, but it's just a list, basically a CT, an ultrasound, an X-ray, and a chest X-ray. So good job, guys. Good job. So you see now it's just with a comma. You just put a comma between all of them. Okay, how about this one? The following labs were ordered: CMP and CBC and TSH. Correct or incorrect? Oh, everybody got that one right. Good job. Good job. So you see that's right. There's that rule. If the conjunctions come between everything, no comma. All right, and that's just shows you. Okay, how about this? Which one of these is correct, or are they both correct? No redness, burning, itching, raised areas, or blisters. And the patient had a normal BP and weight and pulse rate. Okay, you guys, that's good. Everybody got that. Looks like everybody got that right. Good job. Good job. Okay, so let's go back and just look at the beginning of that 6.2.2 where it says to use. Joanne says her problem is adding too many commas. I think a lot of students have that problem. I think that even some instructors, listen, we're all trying to learn, but less is better if you can kind of keep that in mind. But let's talk about where there are internal commas. Let's look at that exception. So, Andrea says, oh yes, me as well. You're not alone, trust me. So vital signs included a blood pressure of 115/82, repeat of 118/88. Okay, that blood pressure and repeat, that's an internal comma right there because there are no verbs. This is just saying repeat of. Pulse rate of 72, normal. Normal describes what the pulse rate is. That's an internal comma. Respiratory rate of 22, comma, elevated. Okay, that describes the respiratory rate. Weight of 118, normal. These internal commas used, you cannot just put a comma like after 118/88. It would be awfully confusing. So if you didn't use the semicolons, look and see how confusing that is. It could get all out of whack. You could have normal respiratory rate of 22, elevated weight. I mean, you could really, trust me, pardon me, you have to use the semicolons. Let's go back and look. You have to use the semicolons for clarity to show what goes with what. This is blood pressure we're talking about. This is the respiratory rate we're talking about. And you need to divide it between the semicolons. Respiratory rate of 22, elevated. And I would say that normally you can say, vital signs included a blood pressure of that, and then you could have the comma, and you could put a period. And you could do that. But when the sentence starts as vital signs included, then, you kind of want to keep that as one sentence. And Helen, that's what I'm saying. If you did use a period, it would be okay. But because this does say vital signs included, vital signs, plural, not just the blood pressure, but it goes over all of them, then, you kind of want to keep it as one sentence. In that instance, I would say a semicolon would be the correct format. Sandra says, guilty as well. I'm trying to do that with less commas. I'm overcompensating for something funny. Jacqueline says, is there an internal comma in one part and if there is an internal comma in one part and a semicolon to use, but then the rest is a list, there are no internal commas, do you continue to use the semicolon between? You don't have to. If it was just like after the right here, after the repeat of 118 over 88, a semicolon, pulse rate of 72, comma, respiratory rate of 22, comma, and that was okay. Repeat of 118 means repeat of the blood pressure. Means that's just the repeat value was 118 over 88. And you'll see that a lot. They'll take, especially if, now this is normal blood pressure, but a lot of times when it's high, you'll see them taking a repeat blood pressure to check, to make sure that a lot of times people get nervous when they get into the doctor's office, and a lot of times it's high to begin with, and then they take it later on just to make sure. And I apologize. They're going to do yard work outside where I'm living, so if y'all hear that, I apologize. Okay. All right, so this is another example. The patient's medications include lisinopril, which was recently increased, talking about the lisinopril, so that needs to be together, an aspirin a day, 81 milligrams. Vitamin D was recently increased to, you don't necessarily need a comma there, but you know, the way he said it may have been, and then calcium. So those are just divided. And labs, another great example of when things need to be used is because it says the patient's urinalysis showed. So it's going to want to give a list of what that urinalysis showed. So the correct thing is to keep that sentence together, okay? It said positive white cells. Well, they were markedly elevated. That goes with the positive white cells. The negative, Joanne, that's what I was saying. The aspirin, you really don't. I was trying to just give kind of an example there, but no, not necessarily. Negative red blood cells, positive ketones, which is a new finding, negative protein. So which is a new finding with the positive ketones, that needs to be in one. That needs to be divided to show that that goes with the ketones. Shelley says, I was always confused with semicolons. This helps a bunch. Well, good, Shelley. I hope so. Krista, a set of results from one test should be kept together in one sentence. If at all possible, Krista, for sure, for sure. Emily says, so the semicolon keeps together information that's related to each other. That's a perfect way to put it. Exactly. So you don't use them. If it was just said, for example, if it had just said, the patient's urinalysis showed positive white cells, negative red cells, positive ketones, negative protein, you could just have commas all between there, just to divide, like a simple list, right? But because there is information that talks about the white cells that needs to be set off from what is being said about the negative red blood cells and the positive ketones, which is a new finding. So if you can kind of keep it like what information goes with what in a list, and you don't always have to use a semicolon, but when they say, if they had just had this had just been a list of labs, just random labs, you wouldn't have needed a semicolon. You could just separate them by period and, periods. So it does get easier, Abra. It does. So here's another one. CBC showed a WBC of 18, elevated. Okay, that's important to know. That goes with that white blood cell count. It's elevated. RBC of 4.0, that's normal. Got to put a comma there to separate it, but then a semicolon afterward. Amazing how this makes more sense when you see it rather than reading. So helpful. Thanks, Angela. I would have put a comma after red blood cells. Let me go back and see. I would go, because of the list here, and especially because positive ketones has an internal comma with it, you have to use the semicolon before and after in this instance. Sandra, okay, hold on just a second. After negative red blood cells, one has to be careful and pay attention to the rest of the sentence and use semicolon. Yes, you just have to pay attention on what goes with what. Sandra says she also gets mixed up when it is added info that is not directly related. I don't even know if I explained that right, but those commas confuse me as well. You know, it's if doctors would just talk in plain sentences and, you know, make it just simple for us, it would be great. But try to look things up, see what goes together. You can always look at, if they give you a lab value, you can always look at normal labs and see whether or not, is this normal? Is this elevated? So, excuse me, it is a tricky part. Does attention, yes. Krista says, Angela, I find hearing and seeing so much more helpful too. Things that seem to stick with the repetition. Well, good. I'm glad you feel like that. It reflects linked information, Helen says. This makes, excuse me, Joanne says, this makes it much easier to understand having it explained this way. Reading page after page of punctuation, I think your eyes see it, but your brain doesn't register. Oh, that is so true. And Christine agrees. Absolutely, Abra. Exactly. Okay, so let's move on so we can get through this. Okay, so we, excuse me. So on this, again, we're dividing what goes with what. Hemoglobin of 11.4, that's low, okay? So that's going to go with that, and platelet count. They're just giving information about it. So it just needs to be separated for clarity. Okay, so we're going to have a quiz. Yes, Krista says reading about punctuation makes me go cross-eyed. And Sandra says, like, for instance, when they say, in my view, or my thought is, that's when I really get lost in the comma. That's another comma topic. We'll get into that. Okay, so on these, let's just go one by one here. The patient is a 55-year-old female. She comes in today with a myriad of symptoms. Is that correct? Is it a run-on sentence, a comma splice, or a fragment? Okay. Oh, good. Yay, yay. Everybody got that. That's great. That's great. Okay, what about the second one, B? I saw the patient. I am referring him to Dr. Name. Okay, good job. That is good job. Everybody is getting that correct also. I love it. The patient presents with nausea and vomiting. She has had this for 3 days. What about this? What about C? That's right. It's a comma splice. That's right. Okay, the last one. The patient states that she has seen Dr. Name before. She would like to see her again. What about that one? Yay, you guys are getting it. Run on. That's perfect. Perfect, guys. All of them are correct. They also could be punctuated this way with a semicolon, just showing that. But periods are fine. It just makes it easier. Okay, how about this? Is this correct? The patient seemed to understand this informed consent was obtained. It's correct or incorrect? Okay. Absolutely, run on, incorrect. Okay, how about this? What about this? Which one is correct? And then maybe both, maybe one. So let's just look. Vitals include a BP of 112/80, a pulse rate of 68, a temperature of 36.2, and his weight is 150. Which is correct? The semicolon or the comma? Yay, you guys are getting it. It is. It's because the conjunction joins the two complete sentences. I love it, you guys. Okay, how about this? The patient's BP is 112/80 when seen by the nurse. It is 120/76 by me. Pulse 72. Weight is 150 pounds. Absolutely, you guys. Yes, very, very good. Very good. Very good. All right, how about this? Orthorex was normal. It was not inflamed. Which are correct? Which is or... Oh, you guys are got it. That's right. That's right. The comma between the first one is incorrect. It's a comma splice. Okay, eyes were clear. Conjunctiva were non-icteric. What about this? We see these all the time. I mean, we just see it all the time. Perfect, you guys. A and C. I love it. I love it. Okay, so everything making sense? All right, let's go over one more rule. And it's the one we just discussed about the conjunction, and we're just adding on because we are just talking about that conjunction, joining those two complete sentences. So if no conjunction joins, you use a period or semicolon. If a conjunction joins, you use a comma. So this is just adding on what we've talked about here today. Okay, so here are examples of two complete sentences. Conjunctiva are clear and sclera are clear. Oh, sorry, no and in between. Two complete sentences. But if dictated with a conjunction between them, you just add the comma before the conjunction. Two complete sentences that can stand on their own with a conjunction, and then sclera are clear. So conjunctiva are clear, comma, and sclera are clear. Sandra says, oh, good experience, extremely informative, awesome, a simplified way so far. I have added down but with but or and or, I still get confused. Me too, says Emily. If they are just keep in mind, if they're just two complete thoughts with a subject and a verb, and it has and, or, nor, but, yet, or, I don't know if I said that or not, you just put them together with a comma before the and. So here are let's go over a couple more examples. Sandra says, oh, good, Emily, I don't feel so bad. And Helen says, splices are what I will watch for. Good, good. Okay, so here are examples with the conjunction used between two complete sentences. The patient came to the ER and labs were drawn. Just put a comma right before that conjunction. Patient temperature was elevated, but the fever came down with medications. But joins the two complete sentences, and you have to use a comma before it. Hemoglobin is 13. Oh, I see this so many times on the labs. Because they're such short little sentences, hemoglobin is 13 and hematocrit is 38, comma, because the and puts it together. If there was no conjunction there, it'd be a period or a semicolon, okay? The and, or, but, nor, all of those change it, okay? The patient will follow up with me, or, sorry, I will send him to cardiology for further tests if needed. Yes, Vivian says, the remainder of the system review, general, HENT, cardiopulmonary, is normal, because remainder is the subject and is the verb. It would be incorrect if you had are normal, because remainder is the subject of that sentence. So you always have to look for what is the subject of the sentence, what is the verb, and make sure that they agree with each other. Vital signs were within normal limits, comma, but the patient's BMI was elevated. Oh, she means is an yes, it is. Yes. Joanne's back to grammar class. Joanne says, why do we need the comma? Always thought and, or, but replace the comma. No, that is, you have to follow these rules. You have to really kind of go over the book of style, go over the punctuation preamble. My best suggestion for learning these rules or going over starting with one of the punctuation preamble rules, look it up in the book of style, write their rule out, write their example out, and then make examples for yourself every day until you get that rule down. Then move on to the next rule. If it's more than 2 items, it does eliminate the comma, though. If it's more than 2 items, it does eliminate the comma. If you have C, but then you had the list of back there and no commas because you said the and takes the comma away. I don't know where I'm at now, on which page I was at. You have to use, if no conjunction is used, you have to use a period or a semicolon between two complete sentences. Well, you guys can look back through this, and if I've made an error, please get in contact with me and I'll correct it for you. Sorry, Yes, Kathy, I'm going to send the PDF file. It's due to the Oxford comma. We do use the Oxford comma. It is the comma. That's in a list. That's in a list. If the subject isn't repeated in the second sentence, you wouldn't add the comma and only use the conjunction, I believe. Yes, Samantha, that is exactly right. If it has to be two complete sentences, if they are independent clauses, is that when a comma before and but or is incorrect? Yes, yes. If they are not complete sentences, that changes everything. This is all what I'm talking about is if they're complete sentences, you have to, if there's no conjunction, you have to use a period or semicolon. If there is a conjunction between two complete sentences, comma before the conjunction. That's all. It joins, that conjunction just joins the two complete sentences. Okay, one last quiz because we're getting ready to run out of time. Okay, so what is correct on this? Vital signs. Vitals include a BP of 112/80, a pulse rate of 68, a temperature of 36.2, and his weight is 150 pounds. Which is correct? Yay, you guys, that's right. That's right. Exactly right. Exactly right. How about this one? Vitals. BP is 112/80, pulse rate is 68, respiratory rate is 16, weight is 150 pounds, and his temperature is 136.2. A is correct. C is correct. Very good. Very good, guys. The patient's BP is 112/80 when seen by the nurse. It is 120/76 by me. Pulse 72. Weight is 150 pounds. Which is correct? Actually, I think I just copied that one. A is the correct answer on that one. A is the correct. That was my bad. There it is. See, I had that. I don't know why I had that copied in there, but A is the correct one. You can't use, because the comma between nurse and it changes it. So A is the correct one. Okay, couple more here. Ears. TMs were inflamed. The ear canal was retracted on the right. Which is correct? Okay, A and B. Very good, guys. Very good. Extremities had normal pulses and good color. No edema was seen. That's right. A and C. Very good. I think you guys know this. The heart had a regular rate and rhythm, and I heard no murmurs. What about that one? It's C, because it has the conjunction joining two complete sentences. You can do this, you guys. So in conclusion, today, a sentence is a complete thought with a subject and a verb. And if you have a subject and a verb, there needs to be a full stop at the end of the thought. You can't use a comma to connect these without a conjunction. But if there's a conjunction joining these two complete thoughts, then you use a comma. You guys can do this. I know you can. Do you have any questions? I've got about 5 minutes left. If anybody has any questions, thank you, Helen. Thank you, Dana. Thank you. Oh, thanks, everybody. I appreciate it so much. Appreciate it so much. This will be posted tomorrow, probably, and I'll have the PDF up there also. Thanks, you guys. I appreciate it. Thanks for coming. I had a good turnout today. It was great. Thank you. Will there be a webinar on Krista, there is something on account specifics, and that pretty much goes in detail about your, okay? Thank you guys so much. Thanks, Kelly. Appreciate it. Thank you guys. Bye. Bye, Helen. Oh, thanks, Sandra. Bye, guys. Thank you so much. There is, Jeanette, there is something on hyphens. There is on compound modifiers. Not sure if you'll send in an email, or you can look through them through the years. They're divided into years on the forum, and you can look through those and scroll down and see which interests you the most, and you can watch them at your own leisure. But if you can't figure out which one it is, send in an email to instructors@canscribe.com, and then you can ask that question, and then we will definitely find the webinar, because I can't think of the name of it right now. Sandra, the web is full of grammar help. Sometimes I think too much and gets me more confused because there's so much. That's all right, Sandra. And you know, you have to use our rules of the Book of Style. Most companies, most facilities out there are using, you know, the Book of Style rules. So it's a little bit different. And it does get confusing. Thank you. Thanks, Jeanette. Sandra says, yes, I like the webinar ones on the forum. There are lots of good ones, and you know you can trust them. Kate, over and out. Have a great day. You too, Sandra. Thanks as always for coming and participating. It's much appreciated. Bye-bye, guys.